What do lymphoma blood test results mean? When it comes to understanding lymphoma blood test results, it is essential to know that these tests provide valuable insights into how non-Hodgkin lymphoma affects the body. However, they cannot diagnose lymphoma on their own. Blood tests primarily evaluate the levels and health of various blood components, as well as certain enzymes or proteins that may change due to lymphoma or its effects on the bone marrow and other organs. One of the key tests is the complete blood count, often referred to as CBC. This test measures several components. For instance, low levels of red blood cells, hemoglobin, or hematocrit can indicate anemia, which is common in lymphoma patients due to bone marrow involvement or treatment effects. Symptoms of anemia can include fatigue and weakness. The white blood cell count is also significant. Low counts, known as leukopenia, may suggest bone marrow suppression or lymphoma infiltration, which can increase the risk of infections. Interestingly, some lymphomas can cause elevated lymphocyte counts. Platelet levels are another crucial aspect. Low platelet counts, or thrombocytopenia, can indicate impaired blood clotting and may suggest that lymphoma is affecting the bone marrow. Additionally, a condition called Pancytopenia, which is a reduction in all three cell types, often points to extensive bone marrow disease. Another important marker is lactate dehydrogenase, commonly referred to as LDH. Elevated LDH levels are frequently seen in lymphoma cases and indicate increased cell turnover or tissue damage. High LDH levels can correlate with more aggressive disease and are sometimes used to monitor how well treatment is working. In certain subtypes of lymphoma, such as lymphoplasmacytic lymphoma, abnormal antibodies produced by cancer cells can increase blood thickness. Blood viscosity tests are useful in monitoring disease activity and treatment effectiveness in these cases. Additionally, inflammatory markers like C-reactive protein can be elevated in lymphoma, but it is important to note that this marker is nonspecific and can be raised in many other conditions. Specialized tests, such as tumor marker tests, flow cytometry, and immunophenotyping, can detect abnormal proteins or markers on lymphoma cells in the blood. These tests help in diagnosing the specific subtype of lymphoma and monitoring disease severity. In summary, abnormal blood test results in non-Hodgkin lymphoma reflected how the disease impacts blood cell production, immune function, and tissue integrity. They assist doctors in assessing the disease burden, guiding treatment decisions, and monitoring responses or complications. However, it is crucial to remember that blood tests are just one part of a broader diagnostic process that includes imaging and biopsies. They do not confirm lymphoma by themselves. Patients should always discuss their specific blood test results with their healthcare team to gain a clearer understanding of what the findings mean for their individual case and treatment plan.